Hello, my name is Carol Messick, and I am a registered nurse representing nurses and patients in hospitals looking to improve patient care and improve patient and nursing staff satisfaction. Nurses many times have great ideas to improve the quality of patient care and their working conditions. But making changes in a hospital can take a long time and much red tape. The initiative Transforming Care at the Bedside uses change processes to quickly let nurses try their ideas on a trial basis and implement those ideas that are successful. This strategy gives nurses the ability to rapidly make improvements benefiting the patients and the staff. It is my plea to Congress to pass a bill mandating that the healthcare initiative Transforming Care at the Bedside, otherwise known as TCAB, become a federal regulation requiring the practice of TCAB on all medical surgical units in all hospitals in the United States. Transforming Care at the Bedside was a pilot project that was begun in the United States in 2001. It was developed and managed by the Robert Wood Johnson Foundation and the Institute for Healthcare Improvement. The goal of Transforming Care at the Bedside is to engage frontline hospital nurses to provide safe and reliable care to patients on medical surgical units, increase vitality and teamwork of nurses, provide patient-centered care to improve the patients and their family members' experience in the hospital, and value-added care processes to make the entire care team effective. The ideas for the Transforming Care at the Bedside come from the nurses, not the executives or the quality improvement directors. The nurses and other involved care team members are the most involved in the patient's care. Their time spent with the patients and their families can help these care team members notice where change is needed, brainstorm and test potential solutions, and decide whether those new improvements should be implemented or not. Nurses typically spend 25 to 35% of their time in direct patient care activities, which isn't very much time with the patient. There's a lot of time wasted for looking for supplies, documenting, and duplicating work through no fault of the nurses. Transforming Care at the Bedside aims to guide nurses in making more efficient use of their time. To implement specific change processes, hospitals will form TCAB teams at the nursing unit level, involve frontline staff in brainstorming sessions to identify problems and suggest ideas for change, do small rapid tests of change, measure care processes and potential outcomes of change, and use these measures to decide whether to permanently implement the changes tested. The goals expected from these change processes are: code blues on medical surgical units are reduced to 0. Drug errors are reduced by at least 50%. Falls are reduced to 1 per 10,000 patient days. Hospital-acquired pressure ulcers are reduced to 0. Increased staff vitality and reduced annual staff turnover by 50%. 95% of patients are willing to recommend the hospital. Readmissions within 30 days are reduced to 5% or less, and nurses spend 60% or more of their time in direct patient care. Some of the examples implemented in Transforming Care at the Bedside projects are standardized postoperative and regular order sets, fall reduction initiatives, nurse status boards explaining with colored dots to the care team how busy the nurse is and that the nurse needs help, whiteboards explaining to the patient who the care team is and what tests will be completed during their stay, nurse-physician bedside rounds, nurse-nursing assistant bedside rounds at the beginning of a shift and at the end of the shift, supply reorganization, reducing waste in the patient's rooms, education on disease processes provided to the patients every shift by the nurses, continuity of staffing, patient discharge improvements, decreasing noise on the units, rapid response teams to evaluate patients before a code blue is necessary, and Condition H, a code the family may call if the patient needs help immediately. One example of a care process implemented by the hospital where I am employed was nurses and nursing assistants working in pods directly outside the patient's rooms. The nurse and nursing assistant complete all documentation within close proximity of the patient's rooms throughout their entire shift. The nursing staff is then available for the patient's needs immediately. By being available in a moment's notice, there has been a decreased length of time answering call bells, decreased patient falls, and increased patient satisfaction within the first 6 months of initiating the program. The opposition to my argument for transforming care at the bedside would say, won't this be lots of extra work for the nursing staff? And I would have to say to that transforming care at the bedside is building on existing initiatives, evidence, and best practice. The program does make demands on some staff's time, but learning sessions to help staff implement the interventions and measure the results are vital in the beginning. The measuring requires some staff time, but it is important as it shows them the difference they are making to patient care. Transforming care at the bedside actually tries to reduce waste and effort and will ultimately lead to more effective working practices. An article from MaineQualityCounts.org in 2011 sums it up best. I will read the excerpt to you. The title is Sparking Innovation and Excitement on the Hospital Unit. Imagine this. During a hospital stay for a routine procedure or surgery, you see pictures of your nurse, physician, nursing assistants, physical therapist, everyone on your care team on a whiteboard across the room. And on your bedside table, you find a small notebook called Questions About My Care that suggests good questions to ask your doctor when he or she visits. And on the day you leave the hospital, the nurse gives you a write-up about your hospital visit, what they did to you while you were there and why, what the tests found, what comes next, doctor's appointments, and what it all means about your health status. It's nothing technical, more of a story about your stay in the hospital that's simple enough to explain to your family and friends. Such personal touches may seem a far cry from standard hospital experiences, but these are real examples of changes in patient care being implemented by a handful of progressive hospitals that are part of a national initiative called Transforming Care at the Bedside. Thank you for your time.